Dear students, welcome back. In this session we are going to discuss about ankle joint. Ankle joint is a synovial joint of hinge variety and it is having articular surfaces, proximal articular surfaces and distal articular surfaces. And this proximal articular surface is formed by the lower end of the tibia, which includes the medial epicondyle and the lateral malleolus of the fibula and the inferior transverse tibiofibular ligament. These structures forms the deep socket, and the inferior articular surface is formed by the articular areas on the upper, medial and lateral aspects of the talus. Structurally, this joint is very strong. The stability of the joint is ensured by the close interlocking of the articular surfaces and the strong collateral ligaments on the sides and the tendons which are crossing the joint anteriorly below the extensor retinaculum, laterally two tendons on the posterolateral side and three tendons on posteromedial side, that is below the flexor retinaculum on the medial side and peroneal retinaculum on the lateral side. So these structures give stability to this joint. Okay, and some of the other structures which are supporting the joint are ligaments. So now we will see the ligaments of the ankle joint. The ligaments of the ankle joint includes fibrous capsule, deltoid or medial ligament or lateral ligament. If you see the fibrous capsule, it surrounds the joint but it is weak anteriorly and posteriorly. It is attached all around the articular margins, of the ankle joint, that is tibia and fibula on the upper articular ends and over the talus around the upper, medial and lateral aspects of the articular surfaces of the talus. Okay, but it is having two exceptions. Posterior superiorly, this this capsule is attached to the inferior transverse tibiofibular ligament, and antero-inferiorly it is attached to the dorsum of the neck of the talus at some distance from the trochlear surface. Simply we can say the fibrous capsule is weak and it is attached all around the articular margins of the ankle joint. Okay, now we will see the other ligaments, that is medial ligament of the ankle joint or deltoid ligament. So this is very strong ligament and which is a triangular in shape and which is present on the medial side. The ligament is divided into superficial and deep part. Both parts have common attachment above to the apex and margins of the medial malleolus The lower attachment is indicated by the name of this fibers where it is getting attached to. Okay, so now we'll see the superficial part. The superficial parts include the tibio-navicular and tibio-calcaneal, okay, and posterior fibers or posterior tibio-talar. These are the superficial part of this deltoid ligament. Okay, so tibio-navicular is the anterior fibers which are attached to the tuberosity of the navicular bone and to the medial margin of the spring ligament. Okay, and then the middle fibers, that is tibiocalcaneal ligament, which is attached to the whole length of the sustainculum tali. So that means it is attached from medial malleolus to the calcaneum. Okay, and the posterior fibers, that is tibiotalar, again it is attached from the medial malleolus and to the medial surface of the talus. Okay, so these are the attachments of the superficial part. If you see the deep part, that is anterior tibio-talar ligament, which is attached to the anterior part of the medial surface of the talus. Okay, and these deltoid ligament is crossed by the tendons of tibialis posterior and flexor digitorum longus. The deltoid ligament is very strong ligament, and which is excessive and is having excessive tensile forces on the ligament, which results in avulsion fracture. Okay, so the ligament is prone to injuries in inversion. So this is about the deltoid ligament, and we will move on to the lateral ligament. So in the lateral ligament, this ligament consists of three bands. One is the anterior talofibular ligament and posterior talofibular ligament and calcaneofibular ligament. The anterior talofibular is flat band which passes from the anterior margin of the lateral malleolus to the neck of the talus, and next one is the calcaneofibular ligament, which is long round cord which passes from the notch on the lower border of the lateral malleolus to the tubercle on the lateral surface of the calcaneum. Okay, and this one is crossed by the tendons of peroneus longus and brevis. And coming to the posterior fibers, this is a talofibular ligament passes from the lower part of the malleolar fossa of the fibula to the lateral tubercle of the talus. So these are all about the ligaments around the ankle joint. Now we will see the movements. What are the movements taking place at the ankle joint? So there are two movements. One is dorsiflexion and plantar flexion. Okay. In the case of dorsiflexion, the forefoot is raised and the angle between the front of the leg and the dorsum of the foot is diminished. It is a closed back position with maximum congruence of the joint surfaces. Okay, next plantar flexion. Next movement is the plantar flexion. The forefoot is depressed and the angle between the leg and the foot is increased. Okay, so these are the movements taking place at the ankle joint. The muscles which are responsible for these movements are, so dorsiflexion, the chief muscle is the tibialis anterior, and the accessory muscles which help in dorsiflexion are extensor digitorum longus and extensor hallucis longus and the peroneus tertius muscle. Okay, next if you see the plantar flexion, the main muscles are the gastrocnemius and soleus. Okay, if you see the accessory muscles, which includes the plantaris, okay, tibialis posterior, okay, and flexor hallucis longus and flexor digitorum longus muscles. So these are the muscles which helps in the movements at the ankle joint. If you see the blood supply is from the anterior tibial, posterior tibial and peroneal arteries. Okay, if you see the nerve supply is by the deep peroneal and tibial nerves. Okay, so these are all about the ankle joint. Thank you.